Okay. A recent survey by KFF.org revealed that, quote, 61% of Americans go without needed health care. Health is one of the most important factors in life, and this statistic highlights the daunting healthcare crisis in our country. With the experience of writing multiple research papers on the healthcare crisis, I have analyzed several accredited publications on this topic. These publications provide various solutions, the most effective being political propositions. The Peter G. Peterson Foundation proposes a solution that suggests reenacting the 2018 Cadillac tax on health insurance companies. Another proposed solution by the American Journal of Medicine recommends regulating pharmaceutical companies through a price cap on medications. Lastly, an alternative solution proposed by the Blue Cross Blue Shield Association suggests increasing funding to the Federal Trade Commission to increase the enforcement of antitrust laws related to healthcare. Before we get ahead of ourselves, we must fully understand the healthcare crisis and its factors. The first aspect of the healthcare crisis is the cost of medication. According to the American Journal of Medicine, quote, citizens of other nations pay 20 to 40% less for prescription drugs compared to what Americans pay. This statistic emphasizes the government's lack of regulation on medication costs. Another element of the healthcare crisis is administrative costs. According to the American Journal of Medicine, quote, we spend more than a third of our healthcare dollars on overhead and administrators. This includes billing, advertising, profits, and bonuses for healthcare executives. This brings to light the massive portion of healthcare costs that go straight to administrators. The last factor of the healthcare crisis that I'm going to cover is the excessive cost of service. The Peter G. Peterson Foundation states that, quote, healthcare experts estimated that 1/3 of healthcare expenditures are inefficient. This is formally known as low value care. This totaled between 760 billion and 935 billion annually. This highlights the correlation between inefficient healthcare expenditures and excessive pricing. Now that we understand the factors causing the healthcare crisis, we can get into the solutions. The Peter G. Peterson Foundation suggests a quote, Cadillac tax would slow growing healthcare costs and increase government revenues, both needed measures for a sustainable fiscal future. The Cadillac tax entails a 40% excise tax on employment-based health insurance plans that exceed a specific threshold, that threshold being the 75th percentile. This would reduce the cost of healthcare by creating more revenue for the government to fund the Affordable Care Act without directly taxing patients. The benefits of this include lower overall health insurance costs, more affordable insurance for those who pay for coverage on their own, and more funding for the ACA, which helps more Americans access needed healthcare. The only drawbacks would be fewer insurance options through employment-based insurers and fewer employers offering benefits. Despite health insurance being a huge factor in the healthcare crisis, more action is needed to fully resolve it. The American Journal of Medicine recommends the legislation of a price cap on medication. This would limit the profit of big pharmaceutical companies and make medication more affordable for Americans. This is a great way to reduce the cost of healthcare without raising taxes. It would also promote an effective use of resources by pharmaceutical companies. Despite the reduction in the cost of medication, quote, some authorities have suggested that if we decrease the profits of drug companies, they will stop developing new drugs. Given that drug companies spend more than twice as much for marketing and advertising as they do for research, this is a very unlikely outcome. Both of these solutions are perfectly viable, but there's more that can be done to make healthcare more affordable and accessible. The Blue Cross Blue Shield Association proposes that legislatures increase funding for the Federal Trade Commission. They state that this would, quote, lead to stronger enforcement of antitrust laws pertaining to healthcare providers to prevent unreasonable increases in provider prices. This would prevent medical companies of every kind from charging excessive prices. This would affect every aspect of the healthcare crisis. The only downside to this is possibly paying higher taxes. Despite this, there are ways to get around raising taxes, like allocating tax dollars efficiently, leaving more funds for the FTC. Despite these policies seeming cut and dry, there is much to consider. The current healthcare crisis in America is one of many issues our generation will have to overcome. Solutions like reenacting the Cadillac tax, regulating pharmaceutical companies, and investing tax dollars into the Federal Trade Commission are all viable political options. Despite lawmakers and politicians making these proposals, it's up to the citizens to educate themselves and choose which options they believe will be more effective. When the time comes to make this decision, please keep in mind that Americans of every race, sexuality, and gender deserve affordable and accessible health insurance or healthcare. Sorry.